Now, let's begin by telling you that striking resident doctors in the Federal Capital Territory have called on FCT Minister Nyesom Wike and Senate President Godswill Akpabio to utilize government hospitals in Abuja to experience the challenges faced by public health workers and patients. The doctors began a 3-day warning strike on Wednesday over unpaid salaries, allowances, and other grievances following the expiration of a 3-week ultimatum issued earlier. President of the Association of Resident Doctors in the FCT, George Ebong, criticized Wike for neglecting the state of healthcare facilities and workers' welfare in Abuja. He noted that while Wike has focused on fixing roads, many health institutions in the nation's capital remain in a deplorable state. So, to discuss this live with us, we are joined by public affairs analyst Jide Ojo. Jide, welcome. Thank you for joining us this afternoon. Let's start by asking, what impact does this strike have on public health service, particularly in critical sectors such as emergency care and also maternal health care?
My brother, is very disheartening, very, very unfortunate that FCT Minister and the mandate Secretary for Health will not resolve this issue, industrial disputes, within the time frame of 21 days that was given by the Association of Resident Doctors. It's very, very heart-rending, very heart-wrenching that public hospitals in Abuja have done to us. You know what the implication of even shutting down public hospital for 1 day is very grave. Patients will have died. Many will have had to compulsorily take their patients to private hospitals where they will pay huge sums of money. That means access to affordable Medicare will be denied in the next 72 hours while this strike lasts. And I'm really surprised because for those of us living in Abuja, we have seen the yeoman's job that Minister Nyesom Wike is doing in the area of infrastructure, particularly road infrastructure. I wonder why he's just indifferent to the plight of Nigerian resident doctors who have no water, no light, a whole salaries, backlog of 1 to 6 months salary. The state of healthcare services in Abuja and FCT in general has deteriorated to the extent that they can even call upon the minister and the president of Senate and even the president to use public hospital and see how bad things have been. And this is quite symptomatic of the general national state of healthcare delivery in Nigeria, which is a negation of the Sustainable Development Goals. How do we have healthcare delivery for all in a situation where there is no light, no water, and medical personnel are being held backlog of salaries, they are overworked? Some of them are on 48 to 72 hours call, having to cater for thousands of patients who could not afford healthcare delivery in private hospitals and clinics. It's quite deplorable. It is condemnable. It is an act of, it is an human act, because we know the brain drain that have afflicted our healthcare service sector over the decades. And the few who have decided to be patriotic to stay behind are having the short end of the stick. Okay. Their training allowance is not being paid. Is it when you are not even paying salary, you want to pay training allowance?
That's a very interesting question. Mr. Ojo, could you also explain the role of the Federal Capital Territory Health Ministry in addressing the wage-related concerns raised by the doctors?
Well, I know that there is mandate secretary for FCT, because FCT is run like a state. So instead of commissioners, they have what is called mandate secretary. So there's mandate secretary for works, for education, for health, for maybe infrastructure for women. So this mandate secretary acts like a commissioner. And of course, you cannot expect federal government to be paying salaries of state workers because the federal government also have its own health, their own hospitals and clinics that are directly run under federal government here. There's Federal Medical Center in Abuja. There's also the National Hospital. These two, I know, are under the purview of the federal government. Right. And their workers are not part of this strike. But for God's sake, I'm just wondering, it's not for lack of money. I think it's just lack of commitment that will make Barrister Nyesom Wike to close his eyes to the flight of ordinary citizens of Abuja who relied on over 8 general hospitals that are in FCT for their own healthcare delivery. I lost my younger sister at the University College Hospital many years ago because of similar strike. And I can tell you for free that only God knows how many people have died as a result of this strike.
Mr. Ojo.
One day can lead to fatalities.
Mm-hmm. Mr. Ojo, so sorry about your sister. Sad to hear. Well, are there any systemic issues within the healthcare sector that have contributed to the recurrence of delayed wage payments? What could it be?
I wish I were working for government. Unfortunately, I'm not. It's them that can even explain, because from what I read, there have been several meetings, formal and informal meetings between the FCT authorities and these striking workers. Promises have been made that were not fulfilled. Pledges have been made and are flagrantly not implemented. And that's why they resorted to this warning strike of 3 days. So I really don't know what the issues are, because a man who works should receive his pay. I recall last year that this is how teachers in FCT also went on several months of strike because of non-payment of their salaries and allowances. So I don't wonder whether Nyesom Wike wants to be Minister of Infrastructure and not just delivering on health and education, which are very critical sectors of every economy. A nation that, and this is the federal capital for crying out loud. This is federal capital. This should not happen. This should have been avoided, because even when you pay these health workers, these doctors, their wages, it is not comparable to what obtains in senior clients in UK, in US, in Europe, in America. So the few ones who decided to still work here, we are not making it worth their while.
All right.
The other day in Kankara local government, 2 medical doctors were shot by bandits. Thank God they did not die. One of them was a first-class brain from Ahmadu Bello University. I don't know whether you read about his case. Was shot by bandits in Kankara General Hospital. And that is the state of our healthcare delivery. There is no security. Now their welfare is not being taken care of. So do we blame these doctors when they go on strike? I cannot blame them in good conscience, because the minister collects his own salaries and allowances. Other workers collect their salaries and allowances and extra quote. Why should the doctor's case be different?
All right,
the
Mr. Jide Ojo.
Are now referring to themselves as endangered species.
Yes, Mr. Jide.
It is very, very disheartening, my brother.
Indeed it is. I wish I could let you continue. I wish I could let you continue, Mr. Jide, but unfortunately we can't continue. But thank you very much for your expert opinion on the matter, and we'll continue to come back to you for more on these kinds of instances.
Mr. President can weigh in into this matter and give a marching order for FCT minister to resolve this issue without any further delay.
All right. Thank you once again, Mr. Jide Ojo.
My pleasure.